Hi, and welcome to the Post-Acute Point of View, our discussion hub for healthcare technology in the out-of-hospital space. Here we talk about the latest news and views on trends and innovation that can impact the way post-acute care providers work. And we take a look at how technology can make a difference in today's changing healthcare landscape in both home-based and facility-based care organizations and the lives of the people they serve.
Hi, everyone. Thank you for listening to our podcast. Today, we have Joanna Rayford, and I will introduce her. I'll also introduce myself, and then we'll get started. So, Joanna Rayford is with Providence Medical Center. She started her career about 17 years ago, actually. She started working in medical surgery at a local hospital in a community out in Nebraska. And then she moved into working as a nurse in cardiology. She worked for a cardiology clinic for the next 6 years. After that, she had an opportunity to become a director of a home health care and hospice. So her director position is at Providence Medical Center, which is both a home health care agency as well as a hospice agency. She has had this position now for 4 years. And especially during this COVID pandemic that we're all in, we're speaking to you in December of 2020. So it's heavy, unfortunately, in the COVID pandemic. But she has just talked about how she really has seen her team's strength and really seen all of the challenges that they have met and been able to really address and still provide quality care to their home health and hospice patients. So welcome, Joanna. My name is Lavin Gravis. I am the Vice President of Service Delivery at HEALTHCAREfirst. And HEALTHCAREfirst, the specific area of HEALTHCAREfirst that we work with is a CAHPS survey vendor for both home health CAHPS and hospice CAHPS, as well as hospice item set files through and reporting of that analytical data through our Quality Action Board portal. So welcome, Joanna. Thank you so much for joining us.
You bet. Thank you for having me.
So I was just going to have you tell us your story, kind of talk about how you became involved with hospice and home health care and whatever information you are willing to share about Providence Medical Center.
Yes, thank you. I have been in my career mostly in cardiology, like you said. I worked at a heart hospital and took care of post-CABG patients for several years, and then went into cardiology, stress testing, and then worked in the cath lab at a local hospital as well. So kind of experienced many different aspects of nursing and thought I would never end up in home health care. And lo and behold, I was looking for a challenge, and there was a position for a director of home health care that became available. So I jumped into that with no home health care experience, which was extremely challenging. But the best part about home health care and hospice is you get to meet the patient in their home on their level. And it's very personal because you're meeting them in their home. And I think that's my favorite part of home health care and hospice is developing that close relationship. You become part of their family and help them during their darkest hours.
Oh, I love that. That is every person that we usually talk to that has been in home health care, we've even for a long time or a new time, that absolutely speaks to them. You do meet them in their home and you are with them. And especially on the hospice experience, you're making sure that not only the patient itself, but their family members, you're really truly giving them, the best level of care that you can during those, end of life care. So thank you so much for sharing that. I wanted to move into now just your experience with HEALTHCAREfirst as far as a CAHPS survey vendor, the quality reporting that you and your team view, how you use the data to address any concerns that your family members or your patients may bring up, or even to, give a shout out and some appreciation for that feedback that you receive on those surveys. And just kind of, walk us through what are your key items that you look for and what's the practice that Providence Medical Center goes through.
Yeah, so we do look at our quality scores often. I've been diving into that a lot here lately. I had a nurse that did a lot of my quality program, but I have taken that over. So we look at our quality scores quarterly. We look at them more often than that, but we come up with our goals quarterly. I do appreciate that HEALTHCAREfirst has everything available to you. You can log into the portal, you can drill down to your patients, and you can actually figure out kind of which patient had negative comments if they shared that. So I like that you can drill down specifically to your clinicians or your patients to see where those negative comments are coming from or why they're occurring. You're able to see those negative and positive comments on your surveys. And our hospital takes those comments and pulls out the positive and negative comments and does share some of those within our whole hospital. We get an email each quarter with all of those comments on there. So you get to see some of those positive comments for your staff, and you get to share those with them, which is excellent. So we really appreciate HEALTHCAREfirst quality program and are able to build our quality program and improve on our OASIS questions to improve our overall quality scores.
That is perfect. I was actually going to ask, how valuable you found the comment alerts and things like that, since we do, all of the surveys that come in, either whether it's home health CAHPS or hospice CAHPS, we do have a comment entry team that takes the comments, the handwritten comments on those surveys, and we code them based on the theme of the comment, if it's negative, positive, serious. And then the negative or serious comments, if there is something that needs to be brought to your attention, then we have an alert system where it sends you an automatic email telling you that there's a comment received that does need attention. So that's really good that you're using it for that aspect, as well as for those positive comments, and to give a pat on the back to the team members that really did a fantastic job and went above and beyond, which every team member does. But it's nice when they get called out for that on a survey. So, and you talked specifically about the drill downs as well. So that's something that we have been adding as an enhancement to our reports over the past couple of years, is just really getting down into that drill down level to where, regardless of what report you're in, you can drill down and look specifically at the whole question set that came in on that particular patient, or regardless, either if it's hospice or home health, look at that. Have you had a chance yet to look at some of the scorecards that we have come out with? I know the hospice scorecard is one that has come out in the past 12 months or so. And so it's a newer thing, but it could be something that if you're not using now, that we would be happy to show you and just make sure that you had a holistic view, because that's really what it's intended to be, and to help you get to what actionable items you can take from the results and then go and set those goals with your team.
Yes, I haven't actually been able to completely drill into that. I'm a smaller agency, so I don't think I had enough data to use that option yet, but I'm excited to use it because, yes, it will show me which areas within my quality program are the ones that I can bump up and improve on the easiest. So yeah, I'm excited to see that scorecard, and that way I can kind of be aware of, hey, this one is an easy one. I could easily improve this within a short amount of time. So let's work on that one and get that score bumped up.
Yeah, and that's exactly what it's intended for. So that's good. Yep, absolutely. So is there a particular favorite report that you have, one that is your go-to every month, or it's certainly on a quarterly basis when you go to meet with your team to set those goals?
Pretty sure it's called dashboard. Isn't there one that's
called... the quality measure dashboard? Okay, good. Yep.
That's the one I really like to look at, just to kind of get an overview and look at everything. So I really appreciate that one.
Good. Awesome. Thank you so much, Joanna. I really appreciate it. Thank you for your time, and hopefully you have a safe end of the year, and best wishes for an awesome 2021. Surely it'll be better than 2020 was, right?
That's right. Thank you so much.
Yeah, thank you.
That concludes the latest episode of The Post-Acute Point of View, brought to you by Matrix Care and HEALTHCAREfirst. We have a lot of guests and topics coming up that you won't want to miss, so be sure to subscribe. If you've enjoyed today's podcast, and if you have a topic you'd like us to discuss, leave us a review. To learn more about our solutions and services, please visit matrixcare.com or healthcarefirst.com. You can also follow us on LinkedIn, Twitter, and Facebook. Thank you for listening. Be well, and we'll see you next time.